You actually have a course, and it's called Combat Cancer and Autoimmune Disease, and it's available and people can buy it anytime on your website. And I had no idea you had such a course. It's fabulous. I listened to it about 3 times, and I'd love to ask you some questions about some of the material in the course.
Sure. And, even though, I'm a board certified family physician taking care of a variety of diseases, and most people I've cared for over the years of my last 35 years of practice have been reversing diabetes and heart disease and autoimmune conditions. But I've seen many, many, many hundreds of people with diagnoses of cancer. And the outcomes when we're using precision nutrition, the outcomes have been literally spectacular. And that's a big part of my practice now that I never thought that would happen this way. But in any case, what I'm saying right now and what I think that the nutritional science supports is that nutritional excellence and precision nutrition for people who have cancer has, you could say, better long-term outcomes when you compare it to chemotherapy, radiation, or conventional treatments. So we're saying that by ignoring or just doing conventional treatments, you're not getting the possibility you have to extend your life, to prevent, and of course, we're talking about not just putting a person in remission, but cancer can be a very slow growing disease, and people could live 10, 15 years with cancer, and it's enjoying their life and preventing the cancer cells from replicating rapidly and taking that course. So we've seen people that have reversed their cancer, and we've seen people just dramatically extend their lifespan, who utilize nutritional excellence and you could say precision supplementation geared towards their particular condition.
That's fantastic. You wrote a position paper called Preventing and Treating Cancer. Can you give us some of the highlights?
Well, and the position I've also published studies in medical journals with the outcome of some of these people with cancer that have had complete remission. Like, for example, I've had numerous people with metastatic ovarian cancer. One woman had 4 liters of metastatic ovarian cancer fluid in her lung, was given several months to live, but she's now alive 25, 27 years later. And that's just that one, but there's multiple people in that position who's thrived where we thought they had dismal outcomes. So yes, the position paper is showing that if we look at studies on certain food and herbs and substances, we find that these certain products like mushrooms, like flax seeds, like wheat germ, like curcumins from turmeric, we have these substances that show that they're protective against cells becoming cancerous. And the same studies that show that these things prevent cancer can actually create cancer remissions or people slowing cancer or be effective for people who have cancer. So the first thing we're talking about, the first key concept here, is the same dietary and supplemental factors that prevent cancer are also effective for people who have cancer. And we should also say that almost all people have cancer. Let me say that one more time, that most of us have had exposure to some cancer-causing elements in our lives that have hit the DNA to cause damage, to create cancer cells in our body. And then so many people, for example, who have breast cancer may recover from that breast cancer before it even can become a mass that can be seen on a mammogram. They may get cancer and have it go away again. So cancer cells come and go. And now scientists are estimating with new advances in cancer blood biopsying, or now we're seeing that probably the majority of adult Americans have cancer. So when you get a mammogram that detects cancer that's big enough to be seen by the human eye, it's been there probably 10 or 15 years. And now that we can detect those cancer cells in the blood, maybe 10 years before a mammogram can, we'll find that like 75 to 80% of women over the age of 65 have breast cancer. The question is really, it's not diagnosing these people with cancer. It's how should people live and how should we all live to keep our body living longer, enjoying our life, and keeping cancer cells in check. So that's one thing. We're talking about this protocol, we were talking about that, the position paper I wrote, And the position paper is to tell that how we live has a huge effect on our total lifespan with regard to heart disease, diabetes, dementia, and cancer. And we have a lot of control over that. However, cancer is unique. And this is why I wrote the book, Disease Proof Your Child. I was writing the book, Eat to Live, which was first published in 2004. So that means I'm writing this book about 20 years ago, right? And in collecting, reviewing 10,000 studies and picking out the best ones to reference in the book and trying to devise this book, I'm coming across a whole section of studies that show that what we do when cells are replicating as a child is the major cause of cancer, more so than what we choose to live as an adult. So I'm saying here that childhood exposure, childhood stress, childhood trauma, childhood exposure to chemicals, childhood exposure to radon or asbestos or arsenic or lead. Like, for example, living in LA as a child is a risk factor for lung cancer. And unfortunately, AJ, I'm sorry that you have this problem, but obviously a lot of people who live in LA are at high risk there because there was even a power plant, there was even a battery plant that was shut down in 2015 that exposed hundreds of thousands of people to high levels of arsenics and lead. But in any case, what I'm saying right now is I wrote this book called Disease Proof Your Child because the evidence was accumulating that I collected. I couldn't put it into the book Eat to Live. I saved it for a later book, which is called Disease Proof Your Child, that showed that when the cells are growing and replicating, when we're growing as a child, and the younger we are, the faster our cells are replicating. And as cells are replicating and dividing, they open up their DNA and they're more exposed to damage from cancer-causing elements in the environment. So even though cancer is not primarily a genetic-induced disease, it still has influences based on our childhood and even the exposure when we're living as an egg in the womb or before the egg is fertilized. So there's even cancer causation can damage the egg and create adult. We're not talking about the cause of acute blastocytic leukemia or brain tumors in children. We're talking now about adult cancers that people get at the age of 50, 60, and 70 years old, by the way. Has their major weight of their causation can occur when the person is in the first 10 years of life or first 15 years of life. So, and that's when so the question is now that, okay, I've had some cancer causing exposure. And that's why, of course, people, why living moderately healthy, I'm not really a big enthusiast of making baby changes and baby step changes. I want people to make more radical changes because we're not just dealing with preventing disease. We're talking about reversing damage that could have occurred earlier in life, right? And there's a lot of things, and obviously there's a lot of luck in the sense that how bad is the cell damaged is it in life? How many DNA crosslinks are broken? So we're talking here that it's not 100%, we're not dealing with 100% certainty, but we have to reduce our risk, live with what we have been exposed to, and do the best we can with the cards we're dealt. And in doing so, this is where devising precision nutrition for people who are at risk of cancer or who have cancer to allow their body to slow the replication and even reverse damage that could have occurred earlier in life. So that's what this is all about. By the way, my book, Disease Proof for Your Child, which talks about how childhood diets cause adult cancers, is my worst selling book. It did not become a New York Times bestseller like my other book. I have 7 New York Times best-selling books. But obviously, it's not necessarily a message people are that interested in and want to learn about, but I think it's really so brave of you and so important that you are coming out public with what's happened to you, and that now you could take what you've used and to help other people and to benefit them both not just nutritionally, but psychologically and emotionally as well.